If you take painkillers or antidepressants, you need to hear this. Studies show that some of the most common medications can silently damage your heart, increasing your risk of heart attack, stroke, and high blood pressure. And the scariest part? Most people have no idea it's happening. Millions rely on painkillers to manage chronic pain and antidepressants to balance their mood. But what if these medications are doing more harm than good? Research has linked several widely used drugs to serious cardiovascular issues, sometimes after just a few days of use. Today, we'll break down the hidden dangers of these medications, the science behind their effects, and what you can do to protect yourself before it's too late. The hidden dangers of common medications. You probably assume that if a drug is available over the counter or prescribed by a doctor, it must be safe. But the reality is more complicated. Medications go through testing, but the long-term effects on heart health are often underestimated. In fact, some of the most widely used drugs, painkillers, antidepressants, blood pressure meds, and even diabetes medications have been linked to increased cardiovascular risks. And while they might help with pain or mental health, they could also be silently setting you up for a heart attack. Let's break down exactly how this happens, starting with a class of drugs nearly everyone has taken at some point. 1. NSAIDs, the painkillers that could be damaging your heart. Non-steroidal anti-inflammatory drugs, NSAIDs like ibuprofen, Advil, Motrin, and naproxen Aleve are among the most commonly used pain relievers. They're marketed as safe, effective, and available without a prescription. But here's what they don't tell you. A 2017 study published in the British Medical Journal found that taking NSAIDs for just 1 week can raise your risk of a heart attack by 20% to 50%, depending on the dose. NSAIDs work by blocking prostaglandins, which help control blood vessel function. This can lead to high blood pressure, arterial constriction, and fluid retention, all of which force your heart to work harder. Over time, this extra strain can increase the risk of blood clots, heart attacks, and strokes, especially in people with existing heart conditions. And here's the kicker. Even if you don't have heart disease, long-term NSAID use could still be silently damaging your cardiovascular system. So what's the alternative? Instead of reaching for NSAIDs every time you have pain, consider acetaminophen, Tylenol, physical therapy, or anti-inflammatory foods like turmeric and ginger. But before making any changes, always consult with a doctor. 2. Antidepressants, the surprising heart risks. Antidepressants like SSRIs, selective serotonin reuptake inhibitors, and SNRs, serotonin norepinephrine reuptake inhibitors, are prescribed to millions of people struggling with depression and anxiety. They're life-changing for many, but they also come with hidden cardiovascular risks. SSR is like Prozac, Zoloft, and Lexapro can increase the risk of abnormal heart rhythms, high blood pressure, and blood clots. SNR is like Effexor and Cymbalta can raise blood pressure, putting extra strain on the heart. A 2018 study in JAMA Psychiatry found that antidepressants can reduce platelet aggregation, meaning your blood doesn't clot as effectively, increasing the risk of stroke and bleeding complications. This risk is even higher for older adults and people with existing heart conditions. If you're on antidepressants and concerned about your heart health, don't stop them abruptly. Instead, talk to your doctor about alternative treatments like cognitive behavioral therapy, CBT, exercise, and diet changes, which can also boost serotonin levels naturally. 3. Calcium channel blockers, a double-edged sword? Calcium channel blockers, CCBs, like amlodipine, Norvasc, and diltiazem, cardizem, are prescribed for high blood pressure and heart conditions. They work by relaxing blood vessels, but they also come with risks. Some studies suggest that high doses or prolonged use can increase the risk of heart attack and heart failure. A study published in Circulation found that certain short-acting CCBs were linked to a 25% higher risk of heart attack. They can also cause fluid retention, dizziness, and abnormal heart rhythms, particularly in older adults. If you're on calcium channel blockers, it's essential to monitor for side effects and talk to your doctor about whether alternatives like ACE inhibitors or beta blockers might be safer for you. 4. Diabetes medications, hidden cardiovascular risks. Some diabetes medications, especially older drugs in the thiazolidinedione (TZD) class, have been linked to heart problems. One of the most well-known examples is rosiglitazone, which was widely prescribed for type 2 diabetes. A 2007 study in the New England Journal of Medicine found that rosiglitazone increased the risk of heart attack by 43% and cardiovascular death by 64%. These medications can cause fluid retention, swelling, and high blood pressure, putting extra strain on the heart. Safer alternatives like metformin, SGLT2 inhibitors, and GLP-1 receptor agonists are now available, but many people are still on older medications without realizing the risks. How to protect your heart while taking medications. If you're taking any of these drugs, don't panic, but do take action. Here's what you can do to minimize your risk. 1. Talk to your doctor. Ask about alternative medications or lower doses that may reduce cardiovascular risks. 2. Monitor your heart health. Keep an eye on blood pressure, heart rate, and any unusual symptoms like swelling or dizziness. 3. Incorporate lifestyle changes, regular exercise, a heart-healthy diet, stress management, and sleep can all support cardiovascular health. 4. Be mindful of medication interactions. Some drugs can amplify the heart risks of others, so make sure your medications are safe to take together. Medications can be life-saving, but they can also come with hidden risks, especially when it comes to your heart. If you're taking NSAIDs, antidepressants, calcium channel blockers, or certain diabetes drugs, it's time to ask the right questions and take control of your health. Watch the next video to learn more about the hidden risks of everyday medications.